Bay Area researchers could soon be joining the effort to examine a controversial treatment we told you about earlier this year. The therapy is for multiple sclerosis, but it's unlike any of the drug treatments currently in use. Instead of approaching MS as a neurologic or autoimmune disorder, some researchers believe there could be a vascular connection.
I mean, there's been things, but not like this.
These three are just back from a trip to the East Coast. But Carol Schumacher, Michelle Jordan, and Simone Biase weren't taking a vacation. The women flew to Baltimore together to receive an experimental treatment.
Really, the beauty was that we each independently came upon this and did not depend on each other. But what a joy to be able to share it.
All three women suffer from multiple sclerosis. The decision they shared was to undergo a controversial procedure based on a theory known as CCSVI, or chronic cerebrospinal venous insufficiency. Its backers believe the symptoms of MS are caused by blockages in cranial blood flow. The pictures on Carol's computer are from an imaging test of her veins. To increase blood flow around her neck and brain, doctors performed angioplasty and ultimately placed a stent in her left jugular vein.
I definitely feel better.
The spasticity, the stiffness in my legs feels gone.
Is the craziest thing. My husband and I can't even believe it.
Michelle Jordan, a mother of two, says MS had forced her to use a wheelchair for trips outside her home. She also received angioplasty.
I'm walking up and down the stairs, and it's no problem.
All three women consider their treatment a success, but patients desperate for relief can often experience a placebo effect, even with surgery. Much of the research community remains skeptical about CCSVI. We first reported on the CCSVI controversy earlier this year when a Stanford surgeon who helped pioneer the technique stopped performing the procedure. He decided to hold off until he could conduct a clinical trial. And in fact, within the MS community, there's been a huge push for CCSVI research with the hope of determining whether this condition truly plays a role in MS.
I think that's obviously the first step. If it's not a real phenomenon, then I think that you can forget the notion of doing surgery.
Dr. Douglas Gooden directs the Multiple Sclerosis Center at UCSF. He's also on the board of the Multiple Sclerosis Society, which recently awarded nearly $2.5 million in research grants to study blood flow in MS patients.
If this really were a cure, it would obviously be very exciting for the patients. The problem is that it has not been established as a valid sort of factor in the cause of multiple sclerosis.
He says the MS Society was motivated in part by the explosion of clinics now offering the procedure, which is being dubbed the liberation treatment, and patients willing to travel across the country, even across the world, to get it. Dr. Gooden expects to have data from the blinded trials in about a year.
It's something that's getting a lot of high-profile exploration in the lay press.
Meanwhile, Dr. Michael Dake, the Stanford surgeon who helped develop the CCSVI procedure, is now preparing to launch a clinical trial of his own. Simone, Carol, and Michelle are organizing an independent fundraising event to help with some of the costs.
It's important that we support the trials and that everything is done in such a way that it becomes accepted.
And while they wait for definitive results, the three women are believers in the relief they say they've found from a disease that threatens to cripple their bodies. Another note, last week researchers in Sweden and Germany released data from 2 studies on CCSVI. Both groups said they were unable to find evidence of any vascular changes in the MS patients they studied. Now, that fundraiser to help defray patient costs for the possible clinical trial at Stanford is taking place this weekend. Go to abc7news.com and click on See It on TV to learn more about that.